Good morning. I'm Eszter Bakó and I want to introduce my 3 months work. The aim of my PhD work is to investigate and understand the effects of topical herbal preparations on human musculoskeletal system and microcirculation. I'm a pharmacist and I'm a PhD student. I work with essential oils and I'm committed to evidence-based herbal therapies. My vision is that the best product should be prepared based on the best science. In case of herbal therapies, especially in case of essential oils, there is an unmet need to find new evidences because these products are often used based on traditional recommendations or without scientific knowledge. Therefore, my mission is to provide more scientific evidence for herbal therapies. I have 2 projects, and in both projects I investigate essential oils. Let me introduce my projects in more detail. My first project is a meta-analysis on investigating the efficacy of topically applied essential oils in musculoskeletal disorders. Musculoskeletal disorders are an increasing health issue globally because they cause long-term pain, physical disability, or reduce people's ability to work. Essential oil therapy is the complementary treatment technique for musculoskeletal pain. It is commonly administered by massage. Demand for essential oils is increasing nowadays. However, the clinical efficacy is controversial because of the lack of scientific evidence. Therefore, with this project, our aim is to provide more evidence for clinical use of essential oils in treating musculoskeletal disorders. Our question is how effective are topically applied essential oils as complementary treatment in musculoskeletal disorders. In this meta-analysis, we will focus on the following outcomes: pain intensity, quality of life, and functional state. The research implication is that this essential oil therapy is beneficial because it causes decrease in pain, improved functional state, and improved quality of life. I performed the search with this search key in 5 databases in October. After the duplicate removal of the articles and after the selection phase, I gained 11 eligible articles for further work, and this project is in the data extraction phase at this time. My second project is a protocol for a randomized trial. In this trial, we will investigate the effects of topical essential oils on human microcirculation. To prepare the body for sport activities, warm-up exercises are often used. There are warm-up products or sport creams in the market in order to facilitate this warming up. These products mainly contain essential oils as active ingredients. Based on the literature and scientific research, menthol has a hyperemic effect, so it can increase the skin blood flow. Juniper and pine essential oils are ingredients of sport creams. There are no scientific evidence on their hyperemic effect. However, they are recommended for this purpose in traditional use. Therefore, with this trial, our aim is to investigate the changes in skin microcirculation induced by these essential oils. Our question is, how does the topically applied essential oils will influence the skin microcirculation in humans? This project is in the early phase, so we are collecting data and discuss the possibilities. Therefore, our PICO is under discussion. In this trial, we want to use essential oil on the skin of healthy volunteers, and based on our preliminary research, we will measure skin blood flow and skin temperature by laser Doppler. Furthermore, we want to use an infrared camera to display the differences in in skin temperature. The clinical implication of this trial is that this will be the first time when hyperemic effect of pine and juniper essential oils will be measured. Based on these results, we have other plans. We are going to conduct another clinical trial in which we will investigate the effects of essential oils on sport performance. So in summary, I have 2 projects, and I want to provide more scientific evidence for healthcare professionals, for sport professionals, and our results can be used by manufacturers as well for product development. Thank you for your attention.
Thank you for your presentation. Now the floor is open for questions or remarks.
Congratulations, very nice talk. I have a question that what is the registration category of these essential oils? So it's cosmetics or traditional herbal medicine, or what will be the product registration?
These essential oils will be ingredients of different products, and the registration depends on the type of these products. So they can used in cosmetics as well, but we want to use in those products which will be registered in traditional medicine category.
Congratulations for your projects. Just one, not a question, really a comment for you to consider. When you measure the microcirculation, then there is a very easy tool, because you cause hyperemia. It's capillary refill time. It is well documented. It can be easily measured. Just one addition to your outcomes.
I just wonder that this, essential oil, so this is not a single thing, but this is multiple different kind of pictures. Then how can you pull this together, since the active components actually could be quite different, aren't they? Or do you do subgrouping or something like that?
In the clinical trial is under designing, and there is a possibility to investigate the mixture of these essential oils. So we can investigate separately, and we can investigate the effect of these mixtures. So we can use...
Yeah, but you already made some selections. So can you really form homogeneous kind of groups? Because the problem could be if these are very different kind of active, these have very different active components, and then the mechanism of action could be quite different.
Yes, in this trial, thank you for your question. In this clinical trial, we want to use pine and juniper essential oils.
I think that the best way to do a clinical trial with essential oils is that to do a chemical analysis in the first step. So we should know what will be studied, not only that this is juniper oil, but we should know what is the exact composition. So well-designed clinical trials should be like this. I know that in the literature there are plenty of trials that do not mention the composition, but this is part of the evidence-based medicine to know what we are studying. And I think that we are here and working together to do projects like this. But you are right, this is very crucial.
Yeah, thank you. And at the Department of Pharmacognosy, we have a GCMS apparatus, and we can investigate and examine the composition of these essential oils.